Well, hey guys, happy Friday. Welcome back to the Q&A. So a highly requested Q&A topic has been for some time if I can chat about a condition called angular cheilitis or angular stomatitis, it's also referred to, as well as pereirae. And so that's what I'm going to address in this video, what that is, what it looks like, hopefully share with you guys some photographs, as well as what causes it, kind of some things that you should be aware of if you are suffering with it, and typical treatments that are indicated and prescribed. So if you're not familiar with angular cheilitis, it is a type of dermatitis, basically, around the mouth. And specifically, as the name implies, it occurs at the angles of the mouth. And it's actually a pretty common condition, and it can happen as a result of a variety of things. It appears red, cracked, it can be uncomfortable, and while it starts often in the angles of the mouth, which are also referred to as the commissures, it can also extend to involve the entire, the top and bottom lips, depending on the underlying cause. And it can last anywhere from a few days to being something that is an ongoing issue, depending on the causative factor. And certain individuals are more at risk for developing this type of inflammation around the mouth. Individuals who are at risk include individuals with a history of what is known as atopic dermatitis or eczema. But not only people with a history of eczema, but also people who may be on medications. Antibiotics are notorious for putting people at risk for developing this, as well as systemic or inhaled corticosteroids. And by that I mean prednisone, the pill that you might be taking for a condition, or if you're somebody who suffers from asthma or reactive airways and you have a steroid inhaler, this also can set you up for developing this type of rash around the mouth. And then also the other demographic of people who falls prey to this are those who are elderly, have just their immune system is getting up there chronologically speaking and is not as robust as it once was, so they're more predisposed to this. And also kind of within the elderly, but outside of the elderly as well, anybody who wears dentures, they are at risk for this, particularly if the dentures are poorly fitted. They move around in the mouth and result in saliva pooling up in the corners of the mouth. Some people, the anatomy of their face and their lips and the lower half of their face is such that they're predisposed to this. Individuals with a more pronounced upper lip are more predisposed to developing angular cheilitis just because of the anatomy of the way the mandible, or what's known as the jaw is also referred to as the mandible. How it's structured kind of just sets you up for this. People who have very pronounced furrows, or what is also known commonly as marionette lines, on the lower face around the lips, they're also more at risk for developing this type of condition. But anybody can get it. You don't have to have one of these conditions. You don't have to be immunosuppressed. You don't have to have eczema. Anybody can get this, and it's pretty common, and I will go into a little bit more as to what causes it. So in terms of causes and causative reasons why you might have this, probably one of the most common causes is just saliva. Saliva is an irritant, believe it or not. It's pretty much all water, but saliva is an irritant. When saliva sits on the skin, it evaporates, and once it evaporates, it pulls more water out of the skin. And if the saliva kind of pools on your skin in the corners of your mouth, like say if you're somebody who sleeps on your side and you drool in your sleep, you have a little pool of saliva there at night, that is an irritant on your skin and leads to angular cheilitis in particular. But not uncommon, people either think about or just subconsciously lick their lips when the lips are dry, thinking that they are moistening them, helping them. But in fact, the action of licking the lips not only physically is pulling water off of the skin, but is also depositing irritating saliva behind, and then that saliva evaporates and leads to cheilitis. It can affect now not only the corners of the mouth, but also the top and bottom lip. This is super common. Children tend to do this more than adults for whatever reason, and they can do it rather aggressively, and they can get such a whopping cheilitis it extends onto the skin around the mouth quite aggressive, quite robustly. So it's not uncommon in those situations. So saliva is an irritant, but also foods can be irritants that lead to this. Certain flavorants in foods, certain spices can just be irritating on the skin. And if they sit there, they pool there. If you're somebody who's just predisposed to kind of pooling of saliva, and then those irritating ingredients in food kind of pool there, it can compromise the skin barrier and lead to a cheilitis. A notorious cause of this is chewing gum. Chewing gum, particularly cinnamon gum. Cinnamon is very irritating, but really any kind of chewing gum. You're chewing the gum, and saliva, small flecks of saliva are coming out and depositing around your mouth and then evaporating. So that, in combination with the mint, the flavorants in the chewing gum, can really set you up for this. There are also things that you put on your lips can be irritants. This is pretty common. So irritants in lip products are not unusual. A lot of lip products are marketed to plump up the skin as lip plumpers, and really what these are irritants that function by causing irritation and subsequent edema that then can lead to cheilitis. So it's not uncommon for people to develop a cheilitis to cosmetic products that contain irritating ingredients. But also if you're putting things on your face that have some the ability that are irritants, they can kind of migrate to the areas around your mouth and cause an irritant cheilitis. For example, if you use a topical acne treatment like benzoyl peroxide, salicylic acid, a topical retinoid, sometimes this can migrate to the area around your mouth and lead to a cheilitis. Which is why, if you go back to my different videos, I shared with you guys a little tip of applying Vaseline around the mouth and also around the eyes to protect those areas from product migrating there. And then the other cause, though, in addition to stuff that you put on your skin, on your lips that is irritating, you can also be allergic to things that you're putting on the skin of the lips that causes this, and that can be present in a lot of the cosmetics, the lip balms, the lipsticks. And you can be actually allergic to something in those that causes this. Probably more common allergens in lip products and cosmetic products that lead to this are fragrance, as well as propolis. Propolis is derived from beeswax, and it is frequently in a lot of lip balms. And people develop an allergy to it, and then they get a cheilitis. And what ends up happening is that they don't attribute it to the lip balm, the chapstick, because it's a chapstick that they've used for many years and had no issue with. And then suddenly their immune system decides it doesn't like an ingredient in that chapstick, such as propolis, and the immune system then decides on your behalf to reject it. So you keep using the lip product, not knowing that it is actually what is causing the problem. And because the lip product has emollients and things like that, it initially feels good going on, but then your immune system rebels, and the cheilitis comes back, quite strong. So that is another common allergen. Lip balms are a notorious offender. And then the other cause of cheilitis that is not terribly common, but it can be somebody with poor nutritional status. Unfortunately, chronic people who suffer from alcoholism are prone to certain nutritional deficiencies like iron deficiency and riboflavin deficiency. They're probably the demographic that is most at risk for this, at least in developed countries. But also people who have certain systemic diseases that affect how they absorb nutrients. they can also develop certain nutritional deficiencies that set them up for developing cheilitis. Also inflammatory bowel diseases, ulcerative colitis, Crohn's disease. Those individuals, as a result of the disease process within their gut and their intestine, they can have problems with absorption of certain micronutrients, and they can become susceptible to this. If you have had any kind of bariatric surgery, gastric bypass, this is also a potential risk. Just any kind of condition where you have the potential for problems absorbing certain micronutrients. And then also, for whatever reason, children and adults with Down syndrome, trisomy 21, a genetic condition, they also have, for whatever reason we don't understand, they also are plagued with cheilitis, angular cheilitis. I mentioned the steroids, corticosteroids, prednisone, inhaled steroids as medications that can set you up for this, but also many of you found me through my Accutane video, and I mentioned in that video that a very, very common side effect of Accutane, generic name isotretinoin, is cheilitis. And if you were taking isotretinoin, whether it be for acne or off-label for something else, you will develop cheilitis. Also, there's another retinoid that causes this that people take systemically, not for acne, but for psoriasis. It's called acitretin or soriatane. So that is a side effect of those medications. Something that people with weakened immune systems or people on antibiotics, on steroids, people who are just immune suppressed for any reason, are having poor nutrition, one thing that everybody in those groups kind of is set up for is the development of a little bit of a yeast infection that can cause this, actually. So cheilitis that is caused by yeast, Candida yeast, is called pereirae specifically. The yeast, which is known as Candida, that is part of our normal mouth flora. It can creep onto the skin of the lips, the corners of the angles of the mouth, and cause a candidal cheilitis or pereirae or angular cheilitis with particular findings of an overgrowth of Candida there. So that is a very common cause. You know, young children, babies, they can develop this. They're nursing, breastfeeding, and kind of drooling a lot, and their immune system isn't quite fully developed, so they may develop this. But people who are on antibiotics can get little candidal and yeast infections in the corners of the mouth. It's not uncommon, as well as the situations of inhaled and systemic corticosteroids. And people with diabetes as well can also develop this. So hopefully, at this point in the video, you're coming to appreciate that having angular cheilitis is not super uncommon. We see it a fair amount in dermatology. All right, so what can be done in terms of evaluating the angular cheilitis? Sometimes a culture is needed to check for overgrowth of yeast, but it's a clinical diagnosis that your healthcare provider can make just based on clinical findings and history and kind of your overall health history. And the treatment depends on a few things, but first of all would be to stop any of the lip balms, the chapsticks that have fragrance or any kind of irritating ingredient, and simply apply a very, very occlusive ointment. Petrolatum ointment is one of the best things that you can do. No, petrolatum is not dangerous, but petrolatum and mineral oil, they are phenomenal ingredients in skincare, and they've been around for so many decades and with no adverse outcomes to human health, and they are fantastic. They seal in transepidermal water loss and help the skin to heal itself. So for me, as somebody personally who suffers from this condition, somebody with a history of eczema, who likes to chew gum, who likes to experiment with lip balms, then flare up my cheilitis, I can attest, both personally and from clinical experience, to CeraVe Healing Ointment. No, this is not sponsored by CeraVe whatsoever. You can get away with other ointments. Vaseline is fantastic. Vani-Ply, Cetraben makes an ointment. QV makes an ointment. So I will list them down below for you guys to make it simple, but those that I list down below are those that are are either petrolatum or mineral oil based ointments that are free of fragrance, common allergens, menthol, anything irritating that's going to muddy the waters of somebody coping with a cheilitis, because it can really be challenging. Outside of just plain ointments to help seal and transepidermal water loss, if there is an overlying infection, whether it be yeast or maybe a little bacteria has gotten there, a topical antibiotic or a topical antifungal medication may be prescribed by your healthcare provider to treat that. In the case of yeast, sometimes an oral antifungal medication can help clear it up a little bit more quickly. Oral antifungal would be, for example, fluconazole, which goes by the brand name Diflucan. So, that would be something that might be considered by your healthcare provider. And then in certain situations, believe it or not, even though I said inhaled and systemic steroids can put you at risk for this, sometimes a topical steroid can be helpful depending on the nature of the cheilitis. It can be prescribed for a limited and supervised period of time. It can do a few things. It can decrease actually the ability of the bacteria or yeast or things to adhere to that skin. And it also can calm down some of the inflammation. But this is not something that you should self-treat with over-the-counter steroid creams or steroid ointments, because that can set you up for many problems. So only under the supervision of your healthcare provider, so that to make sure you don't develop any side effects, to make sure that it is appropriate in that situation. It's not going to be appropriate for every scenario of angular cheilitis, of cheilitis in general. So don't self-treat. Never self-treat. It's a challenging area to navigate. Don't do it alone. Don't do it without the help of your healthcare provider. That is what they are there for. And then, I mentioned in the beginning of the video that some people, just their anatomy of their face sets them up for risk for this. They have just the way their jaw kind of is shaped. And believe it or not, filler or dental implants can sometimes be helpful in that situation. And then also, if you have profound wrinkles around the mouth, you may see some improvement with Botox injections, which is cosmetic. It's not going to be covered by insurance, but that is something that can be helpful, believe it or not, is Botox to smooth out those lines, essentially, that kind of pull and pool saliva or irritants there and set you up for risk for cheilitis. So yeah, I hope this video was helpful to you guys in kind of addressing angular cheilitis. I've been getting many questions to do videos on angular cheilitis, so hopefully this answered those. I will list in the description box some basic ointments that hopefully be helpful to you guys, and I hope this video was helpful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. Talk to you guys tomorrow. Bye.